Yes.
Doctor, now not coming to a question that everyone is concerned about. It's again around skin itself, which is the hydroxychloroquine induced tanning, the HCQ tanning. If you see the number of messages we receive on that concern, and I think it's absolutely fair that they have a concern because it's a new thing. It's causing discoloration. It also affects our body image and self-esteem. So, could you just tell us how do we go about that?
Okay, when you talk about HCQ, it's like, yeah, I understand that concern. Like most of the patients, I think almost 90% of the patients, when they come and sit over here, like they are telling about, ma'am, when I take this, before that I was looking very, very fair. After taking this HCQ, I become like so dark. It's yeah, I understand that concern, especially from a female point of view. When I wear their shoes, I totally understand. I understand their concern. Like HCQ is an important drug that which we cannot avoid it unless you develop some severe reaction, like allergic reaction or the eye involvement, like maculopathy, like eye vision, like impairing the vision. So in such cases, what we can do is definitely HCQ, even though it has some side effects, like most common side effect, what I have seen is the pigmentation, especially in South Indian people that I have seen, mainly over the sun exposed areas. Most of these people were not aware about using the sunscreen also. HCQ definitely cause pigmentation even if you use the sunscreen. But one thing which we can prevent is the impact or the amount of pigmentation is less if you are using the sunscreen right from the beginning of the treatment. That is one important thing. I am not telling that once you get the pigmentation, it will go off, but definitely we can try some skin lightening agents like topical treatment. It will give you some like aesthetic appearance, but I cannot assure 100% result. I am so sorry to tell you that, but right from the beginning of the disease, it's better to use the sunscreen and all the other things, like avoid the sunlight from 10 to 4 p.m. and always wear the umbrellas and wear the hat if it's possible, wear the full sleeve dress. All these things will help to prevent it. But I'm not telling it's 100% protection. But if you are just seeing the risk benefit ratio of taking the HCQ, I would suggest do all these things, but don't stop HCQ. That's a wonderful drug for a lupus patients. If there is no serious side effects, just take it. Do all these things. We can prevent to an extent. That only I can assure you.
Yes, doctor. I think from a patient point of view, all I would like to tell our patients who are watching this is, like doctor said, weigh out the benefits that HCQ is giving you. Hydroxychloroquine is, like doctor said, it's a wonderful drug. It helps control the disease, and it is often given for long term. And what is important to understand that is these skin issues do affect body image, but there are precautions that we can take with regards to sunscreen. And I think, doctor, you had mentioned something for skin whitening, right? If you could just, what was the name of the medicine, doctor?
Okay, it's like like so many things are there. Skin lightening, what I used to suggest is a non-steroidal therapy. Like not usually what they used to do in India, they just go to that one pharmacist and they wanted to take some melalite or skin light or some things will be there. That things contain steroid. That is not good for our skin. So long-term steroid application, unless it is indicated, it's going to harm your skin. The people will feel, then they apply the melalite or skin light or Betnove GM on their face. After few days or few months, their skin becomes so white. But that is actually damaging your skin. Not it's a pure fairness or lightening your pigmentation. Once some of them asked what is pigmentation. Pigmentation means dark coloration, discoloration or dark color over the face.
Yeah, we can call this pigmentation, right, doctor? Like, it's just an example. Can we call that?
Yes.
Yeah. So just for reference, everyone.
Yes, yes. Someone asked that what is pigmentation? Is the dark color or pigmentation, that is a dark color thing, and or darkening of the face or the skin. And so if you are giving some skin lightening, that's, I told you, but just that is we can give some relief. It's not that 100% results.
Yes.
So we suggest something which is non-steroidal, that is safe for your skin. So that also we have to see, because lupus patient skins are very sensitive. They have to see this thing, it is working for them. Not everyone will fit into 1 cup of tea, like 1 cup. That is very important for, because the skin care, it is very much customized. We have to see a dermatologist. They will examine their skin and they will suggest which topical, which cream is better for them, or lotion is better for them. So skin lightening agents means it's not like most of the people are much like aware about the glutathione now. It's like a hi-fi thing now, like glutathione injections, glutathione tablets that so many actresses are taking. So it's like what I'm telling is there is no long-term studies for this glutathione, especially in SLE patients. In some countries, it is banned because of the liver involvement or liver toxicity. So better don't go for such invasive treatment, which there is when there is no evidence in lupus patients, or in even there is no long-term studies. So don't go behind that. You can apply some home remedies, like some people are applying some, especially in South India, they are applying this curd. They are applying some cucumber, this thing, I think salad cucumber thing and all they are applying. I'm not against all such things. Okay, it's better apply that, no problem. But turmeric, they should be there. Sometimes it might cause some irritation to their skin when your skin is so sensitive. So if you feel that any burning sensation with that, stop that cream or stop that home remedy. That is very important.
Okay, doctor. Thank you for clearing that. I think that was a major concern for everyone. So we'll move